Hello everyone, welcome you all to Swan Analytics, turning healthcare data into real-world insights. If you are planning to move into real-world evidence (RWE), learning how databases like Optum work can give you a strong advantage in interviews and real project work. One of the most valuable skills is understanding how different diagnosis tables are structured in Optum and when to use them correctly. In this session, we will look at two commonly used diagnosis tables and understand the difference between them. Once we understand this concept, cohort building becomes much more intuitive. And this is also a topic that frequently comes up in interviews. Now, if you're coming from a clinical trials background, think of often diagnosis table as a combination of MH, medical history, AE, adverse event, and CE, clinical events. It captures chronic conditions like MH, event level diagnosis like AE, and clinically meaningful events like CE, all in one place. A lot of candidates finish their clinical SAS internship and still struggle to get placed. What most people don't realize is that real world evidence is a parallel career path with more openings and higher salaries, but far less competition. If you already know SAS or R or Python, you're already halfway there. You just need to understand how RWE databases actually work. Let's take one real world scenario. A patient, Anita, is rushed to the hospital. And this patient, Anita, has high fever, shivering, and severe breathlessness. She's finding it difficult to breathe. And the temperature is also quite high. The body is shivering. She has known chronic conditions like asthma, wheezing, and glaucoma. If you're not familiar with this jargon, it's okay. She has already got asthma. So it also results in shortness of breath, but not necessarily fever. So she also has glaucoma. It's a condition of the eye. She was taken to the emergency room and it was confirmed that she has pneumonia. So it was an infection in the bacterial infection in the lungs. And when the infection becomes high, it results in high temperature also. For Anita, doctor writes, primary diagnosis, main reason for the visit is pneumonia. This is the final confirmed diagnosis. Secondary diagnosis, all other relevant conditions. So this is how a claim look like, assuming that Anita has insurance coverage. Now she has secondary diagnosis: fever, shivering, severe breathlessness, asthma, glaucoma, etc. Even though she has all these conditions, the clinically correct diagnosis is pneumonia. And you can see there's a claim ID on the screen. There is a identifier, just like we have employee ID. Similarly, there's a claim ID as well. If you're a student, you have a student ID. Similarly, there is an identifier for a claim also. Second thing is first date. So claim, if you're not familiar with this, what is a claim and additional details about this, please watch the video in the comment section, which is pinned in the comment section and also mentioned in the description. So claim ID, you can see first date, that is the date the patient was brought to the emergency room, and location code, LOC_CD means location code. That is a 23, it shows it's an emergency room. So every location has got an identifier. Location doesn't mean a place in like Bangalore. It means which place in the hospital. Can be inpatient, can be an emergency room, can be an outpatient, etc. So every place has its own code because the reimbursement also varies based on the location. Now, let's say this patient came to the hospital. Anita came to the hospital. She was diagnosed in the emergency room, and then she was shifted to the inpatient setting hospital because she needed a couple of days of treatment to recover because it was quite severe. Now, Now it's coming to the inpatient. It's a separate claim. Imagine it's a receipt. Initially, when it was outpatient, it was emergency room, and then that was a separate claim, and then the patient was transferred as an inpatient, and then it's a separate claim. Here, as well, the first date remains the same, but the location code you can say it's 21. It's inpatient hospital. Previously, it was 23 emergency room. Here we can see patient has different diagnosis. Remember, Anita, she was brought to the hospital in a severe condition. They are family members, and it was already the family members also already shared to the doctor what all the conditions she already has, like glaucoma, wheezing, asthma, certain things, and medical history. So certain events of the past has to be always tell the doctor, what all comorbid conditions we have. Let's say somebody has diabetes or blood pressure, then we have to share those details because the treatment changes according to the comorbid conditions of the patient. And coming to DIAG position. So what is DIAG position here? So you can see pneumonia is ranked one, is mentioned as one. So what it means is a primary diagnosis. So it tells which is the primary diagnosis and remaining all are secondary diagnosis. Currently, what the patient is being treated for, but the most important thing that the patient was brought to the hospital for, and that is pneumonia. Asthma she has been having since many years, so it's nothing no new that she's going to be treated. Same as deep glaucoma, it's eye problem, eye disease, and it's been there earlier. It's not a new thing that she's being treated for. So these are all secondary diagnoses. Certain symptoms, we can say breathlessness. So they are symptoms of pneumonia, fever. Similarly, there is a high bacterial infection in the lungs, because of which the body temperature also rose up. Now, why do we need this ordering 1, 2, 3, 4? Primary diagnosis is the main reason for the visit. Secondary diagnosis, everything else that influence the care. So definitely those things also influence the care. When your patient is taking a medicine for asthma or glaucoma, definitely we want to, or any other comorbid conditions, we want to make sure there is no drug interactions, and this new treatment drug doesn't exacerbate the old conditions also. So that is the reason we always need to get the secondary diagnosis also. That is in DIAG position column. They're all clinically relevant also. This this is a ER claim. Now in Optum it is transferred into a data set called medical underscore DIAG. This is the Optum data set now. What you're seeing is a couple of essential columns. Let's take the example of emergency room and how that particular data, claim data, got converted into Optum database. How it gets transformed in the Optum database. These are the claim ID you have seen, and diagnosis DIAG tells all the diagnosis codes. So every diagnosis, whether it is pneumonia, whether it is a glaucoma, everything has a certain code that is shared with the insurance company, and the money is reimbursed to the hospital. So the next one, diagnosis position, again it was already discussed, primary and secondary diagnosis. Then the first date, the date of the visit, the patient was brought to the emergency room. Location code, again it's the emergency room here. Now this is a table we'll be using for index date. What is index date? It is already discussed in a different video. It can be there are multiple ways of defining the index date. In this scenario, let's take it as the first diagnosis of a disease condition. So medical underscore DIAG table is used for index date, cohort entry, comorbidity windows, follow-up censoring, etc. Now you have already seen what is medical underscore DIAG in this example of Anita. Now that will not be the way it actually shows up exactly the way it is not exactly the way it shows up in the Optum database, but because certain things when in the form of story, it was easy to explain to you, and perhaps you can relate and understand better. But in real time, Optum database, we won't have any names of the patients. So it will be PAT ID. It will tell the identifier for the patient ID. It stands for patient ID. Then we already know CLM ID, claim ID. It is already discussed. When the patient went to the emergency room, there was a separate claim. It's like a receipt. And then when the patient was admitted as an inpatient, then there was a separate claim. DIAG, we know that different diagnosis codes. The patient had pneumonia, it has a separate code. The patient had glaucoma as a comorbidity, it's a separate code. DIAG position, we already discussed, it is the whether it is primary or secondary diagnosis. ICD flag, this was not mentioned earlier, the previous example. It is just a dictionary, it's a dictionary of diagnosis codes. Whether it's called International Classification of Diseases. Previously, before 2015 until 2015, there was a diagnosis ICD 9 codes were there, and then it became ICD 10 codes from 2015 onwards. So, in this example, we are seeing, in this particular table that you see on the screen, it's all ICD 10 codes, the latest version. But the patient's diagnosis, if had it been before, older version, of diagnosis codes were used, then you will see ICD 9 flag also. And then we have the location code, we already discussed. Inpatient, outpatient, etc. And we also see the first aid that also we had discussed. So we also have something called POA, present on admission. It means present on admission. One means diagnosis was present at the time of admission. POA equal to 0 means diagnosis was not present. 0 means not present at the time of admission. So in other words, it was developed during the stay. POA is only meaningful for inpatient claims. Outpatient ER claims often have POA equal to 0 or blank. Why do we need POA? Hospitals must report POA to distinguish pre-existing conditions like diabetes, hypertension to hospital-acquired conditions like infections or complications. So how POA is useful in real-world evidence analysis? It helps us to exclude hospital-acquired conditions. If we want to identify baseline comorbidities, we should only count diagnosis with POA equal to 1 that was present on admission. A patient develops pneumonia during hospitalization, then it's POA equal to 0. This should not be then counted as a baseline condition. So if we also want to identify complications of care, then also this variable is important. If POA equal to 0, the diagnosis likely occurred after admission, maybe during the post-operative complications. After the patient went through a certain operation or surgery, they developed certain complications. Hospital hygiene issues, maybe hospital-acquired infections. The hospital staff did not follow the hygiene that was necessary to prevent any infection. Any adverse events, it's essential to identify those adverse events. Now that we have seen the medical DIAG table, now let's go to the next table. It is DIAG table. Medical DIAG is already clear. Let's move to the DIAG table. The table contains diagnosis code, diagnosis description. So one thing is, it gets human readable description. It's not just diagnosis codes, but you have the description of what those codes mean. On the other hand, if you have medical DIAG table, you don't have the description column that tells what those code actually mean. Remember, when you see, it is for the simplicity and example point of view, I gave the name Anita as patient ID, but actually it will be some patient identifier numbers or alphanumerics or numerics. So it won't be having any names. This is for, in order to simplify and put it in the form of a story, I said this. Now, why do we need this table when we already have the other table? This table is a lightweight deduplicated diagnosis table. It is lightweight because it has less columns. Also, the description is given. If it is the medical DIAG table, as an analyst, if we want to know the comorbidities the patient had. In the example we saw Anita, she had a couple of comorbidities like glaucoma, asthma. It would be much easier for us. It would be much lightweight in terms of querying the data. If you're querying medical DIAG, it will take us much more time to query. And also we'll have to do some joins also in order to identify what lookup tables and join with the lookup tables and identify what those diagnosis code mean. because we don't have the description there. Here we have its complete description is there. We don't have to do any joins. Also, the number of records are also less. If you see, number of diagnoses are also less compared to the medical diag because it is summarized. Basically, it is showing the essential diagnosis codes and the comorbidities, but it won't have any things that may not be needed actually. Something are not needed to be billable. For billable purpose also, we don't need it, some of the codes. And also as analyst perspective, it is much easier to query this table. It saves us a lot of time. Remember that we cannot use this for computing index date because the date columns may not be sometimes populated itself. So this particular table is a more simplified version which comes with descriptions used for fast comorbidity flags checking and all, and also less time consuming. Yes, help you understand the concept. Please like and subscribe. If you're preparing for roles in clinical data analytics or real world evidence, RWE, RWD, I also run practical sessions focused on real industry workflows. And in the next video, we will build on this further. Thank you very much.